Hi, my name is Jessica Kirby, and I'm here to talk to you about malnutrition of children in Africa and South Asia. Most people think of malnutrition as someone that is suffering from a lack of food and nutrition, when in reality it includes undernutrition along with overweight, obesity, and diet-related non-communicable diseases. Poor nutrition causes almost half of the deaths in children under the age of 5. The World Health Organization states that in 2014, there was an estimated 42 million children 5 years or younger that were overweight, 156 million were affected by stunting, and 50 million children suffered from wasting. Some key terms that you'll hear throughout this presentation are malnutrition, which is a term used to describe someone that is of poor nutrition. This can include those that are underweight as well as overweight. Stunting is a term used to describe a person, typically a child, that fails to reach their linear growth potential because of poor health or insufficient nutrition. Z-scores is a statistical term that is used to describe how far from the median value of the reference population the child is. Wasting is the low weight of a child compared to their height. Malnutrition is a large issue in Africa. According to the World Health Organization, the leading catastrophic cost to individuals in Africa are obesity, undernutrition, and diet-related non-communicable diseases. 11 million Africans are considered to be in poverty every year due to the high out-of-pocket cost for health care. In 2016, there was an estimated 59 million children that were stunted, 14 million suffered from wasting. The Global Nutrition Report of 2017 reported that the number of children under the age of 5 that are not growing properly is still a staggering 60 million in Africa. And even though globally stunting is decreasing, it is still on the rise in Africa. Wasting is the leading predictor of mortality in children under the age of 5. Poverty, disease, and hunger are the main factors that contribute to malnutrition. These factors are linked to lack of education, lack of access to health care, poor living conditions, and most importantly, the lack of access to safe, healthy, and nutritious foods. Most people think of malnutrition as ending with hunger, but it doesn't stop there. Malnutrition continues with healthy food and improving nutrition all around with education. In Africa, many children also suffer from micronutrition, which is when there is a deficiency in micronutrients. Micronutrients are needed for the body to function properly, and without them, the body has less resilience and is less resistant to fighting off infections. Obesity is another type of malnutrition and is a growing problem in Africa with an estimated 10 million children. This is doubled from the number that was in the year 2000. The following two graphs show wasting and stunting in Africa. Stunting is the result of poor nutrition, lack of psychosocial stimulation, and disease. This is typically seen in children before the age of 2 and has long-term consequences. A child that suffers from stunting will likely have a lack of education due to poor school performance, which leads to low adult wages. Low productivity and an increased risk for chronic disease are all related to nutrition and continue into adulthood. Malnutrition is also a large issue in South Asia. 38% of children under the age of 5 are stunted, and more than half of the 52 million wasted children in the world live in South Asia. South Asia has the highest stunting levels in the world for children under the age of 5. According to UNICEF, half of the girls are underweight, anemic, or both, and 1 in 6 are considered to be too thin. South Asia is growing in economy, but the rate of chronic malnutrition is not changing at the same rate. The factors in South Asia are the lack of nutritious foods due to the high cost and the lack of education in making smart food choices. An organization that helps with malnutrition across the globe is UNICEF. This is an organization that works to save children's lives. They have different areas that they focus on, but overall, their main mission is to better the lives of children and young people across the globe. They work in 190 countries and territories and have different areas of focus. UNICEF is mandated by the United Nations General Assembly to advocate for the protection of children's rights, to help meet their basic needs, and to expand the opportunities to reach their full potential. UNICEF has a program in place that is specifically focused on nutrition. This starts with the mother of the child. The programs have been the forefront for the change to end or lessen malnutrition in mothers and children. They have programs in place where they help mothers receive nutrients, vitamins, and minerals that she needs to breastfeed her child until the age of 2. It continues with working with partners to improve sanitation and water in the areas by providing safe drinking water. They also offer vitamin supplements, deworming, and immunizations, as well as providing food and medical care by working with government agencies. In Africa, UNICEF has partnered with 100 organizations and groups to partner in the Scaling Up Nutrition movement. This is a global effort to improve nutrition at country levels by implementing interventions and integrating goals for broader health, agriculture, and development efforts. UNICEF advocates for exclusively breastfeeding for the first 6 months of the child's life and to continue to breastfeed until the age of 2. They provide supplements such as vitamin A for children from 6 months to 59 months. In South Asia, UNICEF has reported that between 2000 and 2017, stunting has declined from 89.2 million to 59.4 million. Their goal is to have 10 million fewer children with stunted growth and development by the year 2021 and to have a 40% reduction in child stunting by the year 2025. For every child, they have implemented an 1,000-day window period from conception to when the child reaches their 2nd birthday in order to prevent malnutrition. Their plan is to improve nutrition for the mother during pregnancy and lactation, for better feeding and care practices during the first 2 years of the child's life. There is also early detection and treatment for anemia and micronutrients. CARE is another organization that works to end malnutrition. This is an organization that works around the globe to save lives, defeat poverty, and achieve social justice. They work in 93 countries, helping 63 million people with over 950 aid programs. This program helps not only with nutrition, but all aspects that influence nutrition. They specifically have 167 projects that focus on improving nutrition worldwide. They assist in emergencies, help to build sustainable economies, agriculture, and teach and promote healthy eating habits. In Africa, CARE has 2 main projects. They have the Nutrition at the Center and the Herodonde. Nutrition at the Center was founded by the Saul Family Foundation and has a focus on mothers and children. Their 2 goals are to reduce anemia in women and girls from ages 15 to 49 years old, as well as stunting and anemia in children from birth till the age of 2. Their focus is on water, sanitation, hygiene, food security, and women's empowerment initiatives. Haradande stands for Human Capital, Accountability and Resiliences, Advancing Nutrition Security, Diversified Livelihoods, and Empowerment. In a local language in Mali, Haradande simply means food security. This program helps communities to build the skills they need to withstand the shock that they face in their lives, such as drought, conflicts, and instability. They have done this so far by establishing 35 farm, field, and business schools and working with communities to help give them access to weather information in order to plan and respond to the climate issues that they face in their region. In South Asia, a large project that CARE has been working on is Shu Hardu. This project was started in 2010 and founded by the USAID. They targeted 2,000 of the most vulnerable communities in Bangladesh to help provide access to food and to fight malnutrition and reduce stunting. Some accomplishments so far between Africa and South Asia and other areas that CARE has been a part of is pregnant and lactating mothers from over 68 households have received support, including counseling on feeding and breastfeeding practices. Over 5,000 government health and agriculture staff, volunteers, educators, and development agencies have received training to assist mothers and caregivers. More than 10,000 households have received technical support to engage in homestead food production to ensure year-round access to dietary diversity and animal source foods. 12,000 adolescent girls from 21 schools and 5 communities have received nutritional counseling as well as IFA tablets to prevent anemia and to help build iron reserves for when they do become pregnant. Action Against Hunger is another large known program and organization. They are across 50 countries and is in the lead to ending hunger. They have programs in place to treat acute malnutrition with community-based approach, as well as tackling the underlying reasons for malnutrition. They provide safe drinking water, work with communities to strengthen infrastructure, and to provide safe drinking water that will also help to improve hygiene. They have a food security and livelihood program that helps communities improve their income, markets, and access to food. They also offer emergency aid to those affected by disasters. To help with the acute issue, they use an approach called community management of acute malnutrition. This is to treat a child that is already suffering from undernutrition. This is through local, accessible, and outpatient treatment facilities. For prevention of malnutrition, they use an integrated approach that addresses direct and underlying causes. They provide food in emergencies to vulnerable children under the age of 5 and pregnant or nursing mothers. They also train local healthcare workers and their partners to help treat and screen undernutrition. My strengths include that I'm caring, passionate, and educated. I care about children and those around the world, and I'm passionate about making a change. I've educated myself on the issues and the underlying causes. My interests include global issues, children, nutrition, and access to care. Global issues affect everyone everywhere, and working together, we can help to improve access to care and to help prevent the spread of these diseases and unnecessary deaths of children. Anyone can take actions. Some of these actions can be to be an advocate, speak up for children, and urge your local, state, and federal officials to prioritize children in funding. Fundraise. Join a local fundraiser or start one on your own. You can learn and then speak out. Attend webinars and briefings in your areas on things that interest you, and share your message on your personal social platforms. You can also donate. If you can't commit any of your time, any donation can help. Every dollar helps to make a change. I would love to be able to donate my time in helping with some fundraising, along with spreading the word on this large and growing global issue. Innocent children are dying and suffering, and with the knowledge I have gained, I hope I can make a difference in their lives and those around. In case I've added a spark in you, here are some links to the organizations on how you can make a change. Thank you for listening, and I hope that you've enjoyed this project.